Hi, I'm Dr. Anupama. I'm Director of Medical Oncology at Max Cancer Center. Being a woman and being a doctor and being an oncologist, I am very, very passionate about women's health, particularly about women's cancers. I see that working in our culture, woman holds things together for any family unit. Ironically, woman is also the one that gets pushed behind everybody in the line when it comes to taking care of themselves. And that is primarily done by women also. Women put everybody else in the family before them. I think that needs to change. I think women need to be aware of what can affect them. If they are healthy, they need to realize that if they are healthy, the rest of the family is healthy too. We see different kinds of diseases coming up in women now. Being an oncologist, I deal with mostly cancer. We've made a lot of improvement, a lot of strides in preventing cancer, diagnosing cancer early. But big part of it is being aware of what can go wrong with you. Nobody's foolproof, including me. If you educate yourself, you can catch the disease early. There are some kind of cancers which are preventable. Cervical cancer is one of them. If you have a daughter or if you are young enough, and it just doesn't go for mothers, it goes for younger women, it goes for women who are newly married or even for teenage girls. There are vaccines available that you have access to, which can be given to you through your pediatrician or your gynecologist that prevents cervical cancer. Another common cancer that we see in women is breast cancer. And we see much more of that now compared to a few years ago. And we see much more of that happening in areas like Delhi compared to rural areas. And sitting in this part of Delhi, we see a lot of younger women coming up with breast cancer. And, ironically, every time this happens, one question that I get asked is, but I did not have any symptom, I did not have pain. How can this be? How can I get cancer? And why did I cancer? And unfortunately, there is no right or wrong answer to that. There is sometimes no one factor that causes the disease. Again, having said the same thing before, I'm saying the same thing again, that the biggest thing you can do to prevent a cancer is educate yourself, be aware of what symptoms there can be, if indeed there are symptoms, and most importantly, go for preventive screening. There are guidelines for prevention and screening of cancer that are age appropriate. You can sit down with your doctor, discuss them. You can sit down with an oncologist, discuss them, and if you qualify for those, they should be done. And these are repetitive tests. A mammogram done to screen for breast cancer that was done 10 years ago may not really be valid today if you do feel a lump, because that's another question that I get asked very frequently. But I did a mammogram 5 years ago. There was no lump then. But yes, that was then, and this is 5 years later. So these cancer screenings are usually done annually, and there are certain recommendations that we follow. So you should discuss them if you're concerned about the risk of developing cancer. Any family member that has cancer in your family should also raise that concern, especially if there is a family member who's first degree relative, your mother, your sister, should bring about an awareness and effort to look after yourself more and more. I hope this message will raise awareness, if nothing else, and you'll start looking for questions, and you will take care of yourself, because if you take care of yourself, take care of the rest.